The roadwalk was a public enlightenment campaign, both to enlighten the public and the government stakeholders about this condition called glaucoma. As was mentioned, glaucoma is a condition that oftentimes affects people without them knowing. And so the importance of this public enlightenment campaign was to draw the public's attention to this condition called glaucoma that affects the nerves in the eye, oftentimes without the person knowing that they have it.
Okay. You mentioned that it's a gradual loss of sight.
Yes.
How would one know he or she has glaucoma?
Glaucoma has different types, but the commonest type is the open-angle glaucoma, and it's usually painless and progressive. And so a person may not know until they begin to have symptoms of visual loss. And by that time, most of the damage that would have taken place has occurred in the nerve. And so the only way we can tell is when such a person presents him or herself for an eye examination. Now, it's normally not in our culture to just go to the hospital and have a regular eye exam. And so we want to encourage people to take time out, even if it's just once in a year, to go and have their eyes checked. Another way you can do it is by just simply closing one eye at a time. You know, the two eyes work together. So you can close one eye at a time to check that your eyes are seeing properly. And so that's what we're trying to promote.
What happens if one is diagnosed eventually with glaucoma?
When one is diagnosed with glaucoma, then the person would often start treatment. There are various treatment options, but the important thing is to present yourself to an eye hospital or an eye clinic where you can be properly examined and several tests run to see the extent to which the glaucoma has progressed in order to determine what kind of treatment such a person will receive.
Okay, what other steps can one take knowing that the eye is the window of the body?
So one of the things we must do is to educate ourselves about the risk factors for glaucoma. One of the risk factors for glaucoma is the fact that it is something that affects more of those of African descent than other races. Of course, the Hispanics and the Asians are also affected, but with different types of glaucoma. And so because we are Africans, that puts us at risk. The other thing is that if a family member has glaucoma, it's important that you also check your eyes to be sure that you don't have it, because glaucoma is a hereditary disease. That's one thing that has been established. Okay, so it's important that people need to go to the hospital and for glaucoma to be detected early. The fact is that glaucoma doesn't have a cure, but blindness from glaucoma can be prevented. And how can we do that? By checking and early detection.
Okay. What other challenges do people encounter along the way, or you in the course of treating patients with glaucoma?
One of the challenges that we have is the compliance to treatment. Now, one of the treatment strategies for glaucoma is the use of eye drops. And we know how the economy has changed in the last couple of years. A lot of drugs have become very expensive, and you can't blame the pharmaceutical companies because the cost of production is also increasing. And so the likelihood of the patient complying to medications is usually low because sometimes they can't afford the medications. Another treatment strategy is surgery. And the purpose of surgery or even treatment generally for glaucoma is to control the condition or control the eye pressure, which is one of the most important risk factors for glaucoma, but not to restore sight. And so it helps us to prevent the progression of the disease. But some people may have their own reservations about surgery, and so they may not be too comfortable with going in for surgery.
Okay, in a few words, what's the way forward?
Let's educate ourselves about glaucoma. Let's check our eyes from time to time and go for regular checkups for glaucoma.
Okay, thank you, Dr.